We see that majority of the hospital institutions, majority of the healthcare institutions, hospitals and qualified healthcare practitioners are concentrated in urban India. Now if we also look at the government data, it shows that around 70 to 75% of the hospitals are concentrated in metro cities. Now how do you think one can democratize healthcare in a country like India? And what is your company doing in providing, quality healthcare services to patients in tier 2 and tier 3 cities?
Right. The other day I was having a discussion with sir only. Rightly we need more hospitals when it comes to tier 2, tier 3 towns. But also, I showed data where the existing supply, right, the existing mid-size hospitals, they work at a 20 to 30% utilization capacity. So, new age startups or Pristyn, it's a 5-year-old startup. Our first aim right now is how do we ensure that the existing hospitals, work at their full capacity. Hence, we call ourselves asset light. So, being a doctor myself and having worked in the government setup, corporate setup, private setup, what we realized was when you talk about a 20-bedded or 50-bedded hospital, which is generally owned by a single doctor or a smaller organization, there are 3 basic things which they lack and which new age models like ours are trying to help them in. The first thing was on the quality protocols, right? They can't have a NABH accredited full-time with them who can regularly train their nurses or OT technicians. So what we've done is we have a complete team of QCI consultants in-house. So whichever hospital we work with, we first send that team. They train the OT technicians, the OT staff, the ward staff, the paramedics into the latest protocols as per the NABH guidelines. So we know that if a patient is coming to a mid-size hospital, he understands the quality of treatment is going to be the same. Second thing which we realized was that these hospitals will not have access to all the latest medical equipments, right? Because the medical equipments are costly, and as a single practitioner doctor or as a small organization, I might not be able to shell out that amount. So Pristyn invests into all these latest medical advanced equipments. So now, since these equipments are mostly mobile, so when you buy an equipment, you can use it across multiple hospitals. Hence, the utilization of the equipment is better. So what we enable is a patient, suppose he is coming for a kidney stone surgery, will be able to undergo surgery with the same latest equipment in a mid-size hospital, as compared to when he has to go to a larger institute. Third step, what we realized was all the quality doctors, right? So models like ours, we work with full-time doctors, right? All the specialist surgeons, gynecologists, plastic surgeons, they all work full-time in Pristyn, and hence, we are able to utilize them better because, even the mid-size hospital can say that they have a quality plastic surgeon, they have a quality aesthetic surgeon, they have a quality urologist coming in. So when we do this, we enable a hospital to provide the same quality treatment at the NABH level protocols and with a very high quality doctor, and it helps to increase their utilization capacity. So that is the first step which we are doing, and of course when we do it at scale, like sir said, technology plays a very important role.
If you like the video, do like, comment, share and subscribe.